We're good to go. Welcome. Thanks for all being here. I'm excited to be here. I guess I don't get an intro, so I'll introduce myself. I'm Dr. Helen Messier, and I'm really excited to be talking to you about vulnerable plaque, endothelial function, and the glycocalyx. And how many, before we get started, how many of you have heard of the glycocalyx before, the endothelial glycocalyx? Okay, so a lot of you, but there's still some that haven't. Okay, wonderful. I mean, I am really excited because I think this is a whole new field of our understanding of really what's happening in the body, the whole new omics of glycomics that we call it, really the whole set of glycans that are so important in the function in vascular health, clearly, but in a lot of other things in our body. And we're going to be focusing on the vascular endothelial glycocalyx and some of the new interventions that we can do. And why is this important? Well, because, you know, despite all of our efforts and wonderful technologies, cardiovascular disease still kills more people than anything else in our country. And, you know, once every 36 seconds, someone dies in the US of cardiovascular disease. So just from me being up here, that's already a few people. It's pretty scary. So, you know, there's a lot of room to do better than what we're doing, and that's why I'm excited to present this. So a couple of our goals today. Firstly, if you can walk away, being able to list the multiple roles of the endothelial glycocalyx, and we're going to go into those in detail, how it's protective, how it can regulate, and how it can communicate and really control endothelial function. We want you to understand some of the recent advances in the endothelial glycocalyx, sort of the research that's been done. There's a huge amount of research being done right now, and a lot of the clinical studies that are happening. And then to apply those clinical treatments that are proven, and we're going to go over some of that evidence as well, and what can you really do to improve the function of that endothelial glycocalyx. So let's get started, and let's start looking at the endothelium. You guys all know about endothelium, and we've talked for years on endothelial function, right? The endothelium is that single cell layer that lines all of our vasculature. It's, you know, our 60,000 miles of blood vessels in our body, right? That's over 2 times around the earth. That's how many blood vessels we have in our body. And that single cell layer is critical for the function of all of those blood vessels. So it helps to maintain vascular tone and blood pressure. It's those little endothelial cells that release nitric oxide that will allow the vessels to expand when needed and control the blood pressure. It serves as a transport barrier to control vascular permeability, right? We want things to get through, like nutrients, like oxygen, but we don't want those vessels to be too leaky. That leads to edema and all sorts of other problems. So it's that endothelial cell layer that really controls that permeability. And of course, as the blood flows by, we don't want it to clot. That causes lots of problems, as we're going to get into in a little bit more detail in a bit. But it also possesses that antithrombotic and fibrinolytic properties that control that blood clotting. And then, of course, it modulates interactions between the blood vessel wall and the circulating leukocytes and platelets, right? We don't want those white blood cells sticking to our vascular wall normally. But when there's an infection or when there's an injury, we absolutely want those white blood cells to stop flowing by, stick to the wall, and go through the wall. So that's a really fine, dynamic regulatory process that has to happen in order to facilitate that. So that's also what happens at that endothelial layer. And then, of course, there's a whole bunch of other vasoactive substances, cytokines and other things that are regulated at that surface. So there's a really complex interaction that has to happen and a lot of things that need to be done. Now, you'll probably notice in the circle, those are the endothelial cells, but there's also this kind of shaggy blue carpet that's in this cartoon. There's another layer there that we really didn't know about before until relatively recently. That layer is called the endothelial glycocalyx. And if you take a closer look, this is an electron micrograph of a cross-section of an artery, and you can see all these really hair-like projections sticking out, that's the glycocalyx. Now, like the name implies, glycocalyx is made of a whole bunch of glycans, right? What are glycans? Glycans are just long chains of carbomonosaccharides, right? So they're long, kind of sometimes straight, sometimes very complex branch structures of carbohydrates. And they're in the form of proteoglycans, where they can stick out from the endothelial cell layer. And they're also, glycoproteins, and then there's the glycosaminoglycans that are kind of also nestled free into that layer. So it's a really kind of gel-like substance that lines, again, all of those 60,000 miles of blood vessels in our body. Now, it wasn't until recently, there was some really, I think, elegant studies that were done to hypothesize the existence of this layer. Looking at the diameter of erythrocytes going through capillaries and some different microscopic images of live vascular flow, where there's this ultra-thin layer between the endothelial blood vessel wall and the flowing blood. We just didn't know what it was before. And it's pictures like this that were actually really difficult to get, because when you do electron micrographs, you have to desiccate, some of the preparation for making them is desiccating the samples, and that destroys the glycocalyx. So that's why we haven't been able to see this until more recently. And so these are pretty amazing pictures that take a lot of really complex preparation to get. Now, if we sort of turn that into cartoon form, you can see all of the roles that I went over for the endothelial layer. Turns out that it's the glycocalyx that actually facilitates all of those roles that the endothelial layer does. So it's that glycocalyx that regulates permeability. It acts kind of like a selective sieve. It doesn't let any molecules more than about 70 kilodaltons through. It will repel them, keeps things flowing nicely. It helps regulate the inflammatory response. There's a lot of different inflammatory molecules there. As we'll see, inflammation also degrades it, so it's a sort of a good news, bad news. And it kind of acts like a Teflon coating for our arteries, this arterial anti-adhesive. And that's because these glycosaminoglycans, they all have they're very heavily sulfated, so they have a negative charge, and they repel the negative charge of the platelets and the red and white blood cells that are floating by. So it keeps them, Teflon coating kind of keeps them flowing by. And you can see in here, I'm not sure if I have a pointer, but you see this superoxide dismutase. There's a number of different proteins and enzymes that are kind of nestled in this forest of glycans. And that's why it's a powerful antioxidant layer as well, because it harbors all of those different enzymes and proteins. And then it also triggers the production of nitric oxide to allow the vessels to dilate and contract. And this is kind of how it's done. It sort of senses the shear stress. So as blood is flowing by, the glycocalyx senses the stress of that flowing blood, and that's what sends the signal to the endothelial cells to release nitric oxide. So that's what helps to maintain vascular tone. And then it also responds to different molecular signals, sphingosine 1-phosphate, chemokines, cytokines. Those are all, it's quite responsive to those signals. You can see how it transduces the signals to that endothelial layer. And then, of course, it mediates the production of itself, right? We said the glycosaminoglycans, heparin, dermatin, chondroitin, sulfate, that's what makes up this layer. So you can think of it as a SMART layer, and SMART is really an acronym for the S being selective, right? We said it's a selectively permeable barrier. It prevents cholesterol, as you all know, that LDL cholesterol that gets into the vessel wall. That's one of the first things that happens in the process of atherosclerosis. So it's that glycocalyx that prevents that cholesterol from getting through. And again, it prevents the white blood cells and everything else that we went over from sticking to those vessel walls. It's micro-thin, so even though it looked pretty big on that electron micrograph, if you actually took 1,000 of these glycocalyx layers and piled them all on top of each other, that would be the thickness of about a piece of paper. So it's very thin, and you can see why it's taken us so long to really see what's going on in that little layer. And then, of course, it's antioxidant because it harbors all of those antioxidant enzymes that we talked about. And it's a regulator, so it regulates vascular permeability, it regulates inflammation, coagulation, fluid balance. And then the T is a transducer. So it transduces that shear stress of the blood flowing by into that endothelial layer. So what is a healthy versus an unhealthy glycocalyx? This is a healthy glycocalyx. And you can see that when that's robust and all of these wonderful glycans are present, it can do all of those things that we just talked about. But what happens when that gets unhealthy? So when those glycans are sheared off, and we're going to go over in the next slide some of the things that do that, but when that layer isn't present, it gets really easy to see why you can get stickiness of platelets, why you can start to get clotting, why you can get oxidative stress, and why you can get really the beginnings of atherosclerosis. And you see that in diabetes, this is what the glycocalyx starts to look like. So this is a cartoon kind of that poor little glycocalyx that we saw just previously. And when you see this, you can see why the health of the glycocalyx is really a proxy for cardiovascular health, right? Cardiovascular health and glycocalyx health are really one and the same thing. So what happens? How does a glycocalyx start to look like this rather than the previous slide? Well, blood sugar is a big one. Hyperglycemia really starts to degrade that glycocalyx layer. Insulin as well. That's one of the biggest factors. Inflammation, we know that it controls inflammation, but inflammation also starts to degrade that layer. Oxidative stress, again, it's a balance, right? When it helps to control oxidative stress, but oxidative stress can also start to break it down. Toxins break down that glycocalyx layer. Infections do it. Sepsis is a big one. When there's sepsis, there's really a body-wide destruction of that glycocalyx layer throughout all of our vessels. It's one of the big problems. And now you can see why you get all the coagulation that happens with sepsis when you break that glycocalyx layer down. And then different lifestyle factors. You know, all the lifestyle factors that we associate with cardiovascular disease, they all break down that glycocalyx. Stress, sleep deprivation, sleep apnea, hypoxia, all of those things break that down. There are genetic factors. Some people do have the ability to make a more robust glycocalyx than other people. And then aging. So aging also, as we get older, we start to break down that glycocalyx layer. And that's why you can see again, cardiovascular disease increases as we get older. And then it's not, surprising that when that glycocalyx layer breaks down, you can start to get all of these associated pathologies, right? Cardiovascular disease, stroke, atherosclerosis, peripheral artery disease, high blood pressure, diabetes, erectile dysfunction. All of these are associated with an unhealthy glycocalyx. So let's take a closer look at what really happens when we break down that glycocalyx. This is what starts to happen. We get this breakdown of vascular health. We can get, the LDL particles that are normally repelled by the glycocalyx. They can get through, they enter the vessel wall. We can get the formation of plaque. And when you get this kind of vulnerable plaque, this lipid-rich necrotic core with a thin fibrous cap, that's what can rupture and cause clotting, as you can see here. And when you get clotting, right, that you get all of these, occlusion leading to heart attack, stroke, cognitive decline, erectile dysfunction, peripheral artery disease. So it's really important to start screening for this kind of plaque in your patients. When you screen for it, you know that if you see it, they have an unhealthy glycocalyx, number one. And it's not just about the cholesterol level. clearly, because we know that the majority of heart attacks, I think that we'll get to this in the next one, it's really about that plaque vulnerability. You know, arterial stenosis, or a narrowing of the artery that happens when you get the calcified plaque building up, that's less than 50% of the underlying pathology of those really culprit lesions, the ones causing the events. And that plaque rupture accounts for more than 75% of thrombi that lead to the myocardial infarction, and 90% that lead to ischemic stroke. And over 70% of ruptured coronary plaques are not stenotic. So we need to look at it much earlier. One of the ways we can do that is looking at a carotid intimal media thickness, so an ultrasound of our carotid artery. That's really helpful in actually screening for the thickness of the wall. That means that there's inflammation, things have gone through already, and you can start to see some of this plaque, and whether it has that soft plaque, which would be lipid-rich, vulnerable, or whether it's more calcified, which is actually safer. So I think Vasal Labs is also here, and they can demonstrate. If you want to try it on yourself, I think that's it's really important for everybody to know. So that vulnerable plaque is the stuff that's really dangerous. And like I said, it has that lipid-rich necrotic core. This is just a picture of kind of some of the processes that lead to it in a diabetes model. So you can get the dyslipidemia, the hyperglycemia, the insulin resistance, all of that leading to oxidative stress, advanced glycation end products that allows the LDL to get through, the oxidation to happen, the macrophages to come along and gobble up that LDL and form the foam cells that you're very familiar with. But one of the things that's missing from this picture is the endothelial glycocalyx, right? None of this could happen if there was a robust glycocalyx protecting it. So, we can use, like I mentioned, the CIMT as a tool, and we can start to identify these different types of vulnerable plaque, and by extension, know the health of the glycocalyx. And it really, I think, gives us an opportunity to act earlier and earlier, right? We don't have to wait till there's an MI. We don't have to wait till there's a stroke. We need to be preventing this, and this is really an opportunity. How do we do that? Well, that's what I want to get into in a sec. So, it gives us this ability to look at the root cause. And what's that root cause? Well, I think I hopefully made a case that a lot of that root cause is this glycocalyx. Now, it's incredibly resilient structure, and it's also incredibly sensitive. So it's kind of a good news, bad news story, right? It can be damaged very, very easily. A lot of things like we showed you, high blood sugar, stress, aging, all those things can damage it. But the good news is that it builds up really quickly. If you, in sepsis or post-surgery, if you have a complete destruction of that glycocalyx, it can rebuild in about 5 to 7 days. So it's important to maintain the environment in the milieu that will allow for that glycocalyx to keep regenerating and stay healthy. And you want the regeneration to be higher than the destruction, right? So of course, in someone with diabetes who has constant high blood sugar, there's a constant insult and breakdown of this glycocalyx. It's really important to give it the building blocks that it needs to rebuild. And that's where Arterosil comes in. Now, Arterosil is a product made from a sulfated polysaccharide, which is a green seaweed called rhamnin sulfate. And it has a structure that's very similar to a lot of the glycans that are in the glycocalyx. And it can be used as a building block to build up the glycocalyx. It's patented. Just last year, they received a patent as the only product to regress and stabilize vulnerable plaque. So that dangerous vulnerable plaque that I went over, it actually is the only product that's capable of doing that. And one of the things that I really like about Calroy, which is the company that makes Arterosil, and I think probably the reason I'm here talking to you about it today, is that they've invested a lot of money in doing the research to prove that this works. That's very different than a lot of companies I think that you will see, where there's a lot of talk and not a lot of evidence behind what they do. It's expensive to do the research, and that's why a lot of companies don't do it. But Calroy's invested over $25 million so far, both in vitro, animal, and in human studies. And I want to kind of go over some of those studies with you today. So from all of the studies that were done, there was two key insights that came from that. The endothelial glycocalyx, like I said, is both fragile and, the good news, it's also resilient. And that this polysaccharide, this sulfated polysaccharide, is really the most potent restorative agent for the glycocalyx. So they actually did an in vitro model where they made, sort of an organ on a chip, an endothelium in vitro, mimicking the pulsing blood flow and a microfluidic structure, and they used that to screen for all of the different compounds to see which ones actually restored the glycocalyx best. And that's where the rhamnine sulfate came from. Now, this is a study using that in vitro model. You can see on the left, the bar on the left is a normal glycocalyx, and it's measured by percent fluorescence. So 100%, that's kind of where normal glycocalyx is. When they added sugar or glucose, you can see how the sugar broke down the glycocalyx. That's the next bar, and then added different, I do have a pointer, added different levels of the Arterosil, different concentrations of Arterosil, and you can see how Arterosil restored the glycocalyx, and in some cases, even above what it was normally. And so you can, the finding of this study was that it repairs and regenerates a glycocalyx that's damaged by high blood sugar. So now, we have, hopefully, a robust understanding. Hopefully, we met that first objective of the glycocalyx and vascular health. We know that Arterosil has the ability to restore it, at least in vitro, and I'm going to show you some in vivo studies in a sec. And so you can kind of anticipate, knowing the importance of the glycocalyx and vascular health, you can anticipate the importance of Arterosil in overall vascular health. And that's what we're starting to see in the research. So there's a multi-million-dollar research agenda. This is one that was done in animals. So this was in mice. And they looked at a section of one of their arteries. And they're, normally, like I said, white blood cells shouldn't stick to the lining of the artery. And so at baseline, there was like 3 looking at this one section of the artery that were stuck. And then the glycocalyx was removed with hyaluronidase, so an enzyme that breaks down that hyaluronic acid structure. And you can see that now there's a whole bunch more white blood cells that stick to the side of the artery. And then this is the control with saline. Even when it's washed out with saline, the destruction is still there. Lots of these leukocytes sticking to the wall of the artery. But when you add Arterosil, you can see after it's degraded, lots more stick, and really within 30 minutes, it's back to baseline, that those leukocytes are no longer sticking. So it really inhibits that leukocyte adhesion. Now, this was done in humans. This is a study using a pulse wave plethysmography device called Max Pulse. And what they did is they took subjects before, that's the gray line, I think it was about 2 hours after breakfast, and then they gave them just a single dose, 1 capsule of Arterosil, and measured the pulse wave plethysmography, their arterial elasticity, every 30 minutes after taking it. And these lines show you at 2 hours. So just 2 hours after taking a single dose, in 80% of the people, there was an improvement in arterial elasticity. And in fact, it was about an average of 89.6 increase in elasticity. This is one I'm sure you're all familiar with. This investigator, Dr. Houston. Dr. Houston did a study in his clinic where he took 10 uncontrolled people that had high blood pressure, hypertensive, put them on the standard dose of Arterosil, which is 1 twice daily, and then looked at their blood pressure at 1, 2, and 3 months. And you can see that the diastolic blood pressure at 3 months was significantly reduced, with the only intervention being the Arterosil. Now, there was systolic, there was a downward trend, but it wasn't a significant result. But it did significantly reduce diastolic blood pressure. And then this is a really, I think, a really exciting study. Now, this is the proof of concept study using an MRI plaque view. Now, plaque view is just a software program that takes the MRI images and is able to distinguish the morphology of the plaque. So you can start to see, is this plaque, does it have that lipid-rich necrotic core, the vulnerable plaque? Is it hemorrhagic? Is it calcified? And it gives you a really in-depth view of the plaque. And this was a proof of concept study, and the results were really so remarkable that a much bigger study actually is happening right now, and did a larger study design. And what they showed was that just 2 capsules of Arterosil twice a day, so these were a male and female, 65 years old. They did the MRI, and then 69 days just after baseline, you can see that there was a 64% in the female and a 6.8% reduction in that vulnerable plaque, that lipid-rich necrotic core. Again, the only intervention being that sulfated polysaccharide, the Arterosil. And there was also a significant decrease in the stenosis as well. This is a study just recently that was done, and it's looking at a mouse model. So this is an ApoE mouse, knockout mouse model. So these mice, when they're fed a high-fat diet, they spontaneously develop all of these atherosclerotic plaques. It's a really severe model of atherosclerosis. And they took these mice, and half of them were given the seaweed, so Monostroma nitidum, that's the seaweed where rhamnin sulfate comes from, and the other half were given the control of cellulose, and that was just added to their mouse chow. And after 12 weeks, you can see they looked at the aorta of the mice, and on the left, this is the control mouse, and you can see all these little red areas or pinkish areas. Those are all atherosclerotic plaques. In the one that was fed the rhamnin sulfate, you can see there was much greater reduction in plaque. And that was, again, the only difference. So there was 60% reduction in plaque in that mouse model. There was actually another study that was just published, I think it's just published this month, looking at rhamnin sulfate, again, using an in vitro and this mouse ApoE knockout model that showed that not only did it reduce plaque, it actually reduced inflammation. One of the other things that this polysaccharide does, rhamnin sulfate, is actually inhibits NF-kappa B. And if you know, NF-kappa B is one of the central drivers of inflammation. So it can start to reduce inflammation. It also bound to platelet-derived growth factor. That's what's needed to start that vascular remodeling of the artery lining. And again, so we're starting to learn a lot of the mechanisms of why this works. Not only is it a building block for the glycocalyx, it actually has a lot of other mechanisms, anti-inflammatory and preventing some of that vascular remodeling. This was a study, again, done in Dr. Houston's practice, where he took 20 patients with diabetes and really severe lower extremity neuropathy. And they were placed on, the Arterosil, which is a little bit higher dose than we talked about before. So this is 2 capsules twice a day. And again, they were assessed at 1, 2, and 3 months. And they looked at the questionnaire, the validated neuropathy total symptom score. There was an 11% decrease in neuropathy symptoms, which was numbness, burning, paresthesias, temperature, sensitivity. And then they also used a device that looked at microcirculatory effects and C fiber velocity, sweat gland function, and again, saw quite a significant improvement in that measurement as well. So it really can be a nice tool in your toolbox for those diabetic neuropathy patients that are really difficult to treat. So, the endothelium was really dependent on a healthy glycocalyx. And Dr. Houston quote here, the glycocalyx and endothelial lining are now the priority in establishing prevention and in treatment of cardiovascular health. So if we're not addressing that glycocalyx, we're not doing everything we can for our patients in preventing and reversing cardiovascular disease. So up to date, I think hopefully shown you that Arterosil can repair and regenerate the glycocalyx. It can stabilize and reverse that vulnerable lipid-rich necrotic cord plaque. It inhibits endothelium-mediated inflammation, improves arterial elasticity, helps to maintain blood pressure. And that's not all. There's a whole bunch more studies happening. There's another one I mentioned, that Plaque view study that's happening right now. There's some cardiometabolic markers looking at genomics, proteomics, metabolomics that are done in an animal study, the effects of that with Arterosil. And another one in humans looking at plaque on people who are on statins. So more evidence to come, which is really exciting. And Dr. Joel Kahn, I'm sure most of you know who he is. His quote is, "There are literally maybe 5 natural products that have good clinical, basic science, and clinical measurements that show that they can improve arteries," right? Our toolkit's not that big, that are independent of lifestyle. And Arterosil is one of those very few elite natural products that has great biochemistry and great clinical data. And again, there's really very little, it's a food, it's a seaweed. One of my hypotheses is that we talk about the Japanese having low rates of cardiovascular disease, and we say it's probably all the fish they eat and all the omega-3 fish oils. It probably has a lot to do with it, but it may also be the seaweed that they eat. They're getting the building blocks to regenerate their glycocalyx. And so who should take Arterosil? Well, really anybody who's at risk for cardiovascular disease. So regardless of age, if they have a family history of heart disease, stroke, high blood pressure, diabetes, erectile dysfunction, really any type of circulatory problem, people on hormone replacement, and honestly, because our glycocalyx starts to degrade as we age, it's really, anyone over 45 should consider taking it. I actually take it too. Again, I think, Arterosil booth is out there. You can get a lot more information on it. And there's a number of places where you can get it. It is sold through healthcare practitioners only. And here's all of the references. And now, if you go to Arterosil's website, you can see, all these references will be available to you. There's some patient education material that you can get, some nice videos, a really nice resource for you to actually learn more about this if you're interested. So with that, we'll go to some questions. Yes? Thanks. Thank you. Yeah. Yeah. So I'm going to hand this around, but the question is, how do you monitor the glycocalyx? And I think that's a really tough one because it's so, so thin, so vulnerable. It's really hard to see and to assess. So really, we use plaque, we use endothelial or the CIMT thickness as a surrogate marker. We can infer that the glycocalyx is damaged in that case. And then the other parameters, you look at inflammatory markers, you can look at obviously blood pressure and other things, diabetic neuropathy symptoms. You almost have to sort of infer that the glycocalyx is damaged in those cases. Yeah. Yeah, so the question is, we're doing a study with statins, that's correct, to see the effect of Arterosil with and without statins. Not currently looking at other supplements in conjunction with it. That's a good question. There's a lot of wonderful questions that we should be asking and looking at, and it's just, plugging away at those studies one at a time. As you know, studies can be really expensive. But it's a good point. Now, don't forget that lifestyle, this isn't the replacement for the other things that you're doing, right? You still want them to change their lifestyle, eat a really good, heart-healthy diet. Still want to look at using omega-3 fatty acids, all of those other things that you've learned and are doing. This is an additional tool in your toolbox that can really be powerful. Yeah. Okay, there and then there. Yeah. Yeah, good question. So no, the question is, are there any side effects? As far as we know and have seen and used a lot, no side effects whatsoever. It's really a food, if you consider it, it's a seaweed. And so obviously there's always a possibility someone might be allergic to a component in it. That's with everything we take. But no side effects whatsoever or interactions that we've seen. Yeah, has it been looked at with CT angiography? Not yet. The Plaque view is the one that's been done. Now, I think practitioners in their offices have looked at that, but not, so we've got some anecdotal evidence, but not in a formal study. We'll go to Paula, and then, yeah.
First off, Dr. Helen, thank you very much for your presentation. I have one question and one comment.
Mm-hmm.
My question is, because of our American model, where you can't get some of these tests until you've actually been diagnosed with some kind of heart disease,
Yeah.
for those of us who are able to just get a plain old calcium score,
Mm-hmm.
do we have any research that says Arterosil will impact or lower calcium score? And then my comment is, the slide that you have, who is Arterosil indicated for? My reframe would be people with blood vessels.
That's great. I'm not sure if everybody heard that, but her reframe was, anybody with blood vessels could benefit from Arterosil, which I think is true. Now, previously, we have not looked at coronary calcium. Now, remember the difference in using these different modalities in terms of assessing plaque. Coronary calcium scoring looks at calcium, right, in the coronary arteries. Calcium, when calcium gets deposited, that's the body's way of stabilizing these vulnerable plaques, right? We want those lipid-rich plaques that have that thin fibrous cap, that necrotic core. We want them to get a thick fibrous cap. We want them to get calcium. That stabilizes the plaque and makes them less vulnerable for rupturing. So that's a good thing. That's actually what we're aiming for. And so you always have to take the coronary calcium a little bit, understand what you're looking at. When you see it, does that mean they have plaque? Absolutely. Does that mean they have vulnerable plaque? Well, we're not sure. They may, but it may be a more stable plaque. That doesn't mean that it doesn't start to cause stenosis, and that's also a problem. But the different modalities do look at things a little differently. That's why I like the ultrasound. It's a nice way of really getting a good look. And honestly, we should be looking for plaque anywhere in our patients. If we see it, we have to jump on it really quickly. They're at risk. And I think it's because we haven't done that we still have such high rates of cardiovascular disease. Yeah.
Does anything that raises nitric oxide then also tend to help repair the glycocalyx?
Yeah, that's actually a really good question, right? Does anything that helps, some of the nitric oxide precursors, does that help the glycocalyx? I don't know the answer to that. It very well may. We know that it supplies the building blocks for the endothelium to produce nitric oxide. We know that the glycocalyx is needed to send that signal, so you can assume that in order for it to work, you actually need a functioning glycocalyx in the first place. Yeah. 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 The carotid ultrasound, does that give, yes, it's a great tool. And it's one that's just really easy to get. You know, you don't need a big CT scanner. There's companies I mentioned like Vaso Labs that will even come and do them in your office. You know, you can get your patients that you feel are at risk. Actually, I would do it on every patient. I'm surprised a lot of times people that you think, they shouldn't have a problem. They have a great, you know, healthy lifestyle, good cholesterol levels, all of that, and you start to see plaque. So, yeah. Mm-hmm. I would, you know, should you repeat it in 3 months, sort of after you put them on Arterosil? I would sort of maybe give it 6 months or a little bit longer. I don't think you'll see too big a difference in the ultrasound results in 3, maybe a little longer, yeah. Yeah. Awesome. Any other questions? Oh, in the back. Yeah, no, the iodine content, so considering it's a seaweed, have we seen any issues with thyroid function? The answer is no, but obviously, you know, if you have someone with thyroid issues, you want to monitor that. Yeah, but no, the iodine content's not that high. In the very back. Yeah, how do we compare with the competitor? Yeah, you know, it's a good question. I mean, one of the research is there's been no head-to-head comparison, and so I can't say exactly that, but I can say that the research has been done, you know, to prove this one, and could another product work? It's possible, but so I guess I can't answer that without the head-to-head comparison, and I don't know if Andy, if you want to answer in the back if you've done more research on that. Yeah, no, that's good, and that the competitor has a different polysaccharide. And rhamnine sulfate, to your point, there's a lot of other groups that have published on rhamnine sulfate and the benefits of it. So, you know, not only are the studies that Calroy has funded, but also a number of other studies. If you go in the literature, you can see those. Yeah. Mm-hmm. Mm-hmm. Yeah. Yeah. Those studies are ongoing now. So the one with the statins is a placebo, you know, it's control group. So yeah, that's the right question to ask. They need to be adding those controls as well. We do have controls in the mice ones, obviously. Humans get more challenging, but that's being done. Yeah. Awesome. Oh, one more. Sorry? Are the slides available? Yes. They actually, I think most of these slides are on Arterosil's website. So if you go to Arterosil, and there may be a talk of mine on there as well that you can take a look at. Yeah, absolutely. Awesome. Well, enjoy the rest of the conference, everybody.